Hey, Cynthia from Sin City, NeuroNP. So when I was a kid, my grandmother, I'm not sure if it was her or someone else, who was diagnosed with something, and she said it's acute, which means bad. And I was maybe 8 years old, and so I went through my whole life thinking that the word acute meant bad, like whatever it was acute bad. And that turns out that that's not what that means at all. so, um, and so I just wanted to kind of differentiate between acute and chronic today. So this isn't necessarily specific to neurology. This is just specific to, being a nurse. Maybe you're just learning. Maybe you aren't exactly sure what that means in the front of whatever. So acute just means that it happens suddenly and it's happening right now. So you can have acute cystitis, UTI, that's acute. But then let's say you get UTIs all the time, chronic UTIs. So there's chronic diseases and there's acute diseases. So an acute process means that it just happens suddenly and it's happening right now. It's going on, and it needs to be treated. Then there's those chronic diseases, and those chronic diseases have been going on for a while. Sometimes those acute diseases will become chronic. So things that are chronic, like dementia, that's a chronic neurodegenerative disease. Diabetes, chronic hypertension. But then there's acute things, acute encephalopathy. So let's say you're at home and this patient is, or they're normal, and then they have an acute change, meaning it happens suddenly, and acute onset. So acute encephalopathy. Now there's also things that are acute on chronic. So we call it acute on chronic, meaning that their chronic disease has gotten suddenly much worse. So acute on chronic dementia. So let's say that they have dementia, and then suddenly now they have a UTI, urinary tract infection. So now they have an exacerbation of that dementia. So their symptoms are a little worse. So it's acute on chronic. Or same thing with like a kidney injury. Maybe you have your patient has chronic kidney disease, and then you see acute on chronic, meaning that their chronic disease has just gotten a little worse for a little bit. It may go back to being where it was, but acute on chronic. So that's the difference between chronic and acute. And I usually like to say things are chronic once it's been about 3 months. That's chronic. Okay?